Hello guys. Welcome you all back to our channel. If you are a returning subscriber, thank you so much for coming back. If you are new to our channel, please feel most welcomed and click on that subscription button and that post notification bell so that you'll be notified when we post our next. So in today's episode, I'm going to talk about how to stop vaginal yeast infection and that itchy feeling. So you might wonder, is your white discharge normal? So feel most welcome, relax, and let's learn together. So white vaginal discharge can be normal, but if it is itchy, causes soreness or burning, then something may be going on down there. So if you had these symptoms, would you feel comfortable talking about it, or would you feel embarrassed or even ashamed? No, you shouldn't. Many women don't want to share these details. Maybe you think you've done something wrong, are afraid what others will think of you, or you come from a cultural background where women's problems are not discussed because they are seen as a taboo. Well, I would argue that this information is vital for our health physically and even mentally because it helps us determine what's normal for our bodies and when to seek medical attention. So it also helps us to make informed decisions about our health and to to communicate better with our doctors. So we are not born ashamed of our bodies, aren't we? So it's something we learn so we can unlearn it. So this shame can be harmful to our self-esteem, our confidence, and even our health. So I'm creating this content in the spirit of enlightenment, education, and empowerment of our own health and in our well-being. And in most of the places where we live, such information are not shared. So as I've said, I'm creating all these content in the spirit of enlightenment, education, and empowerment of our own health and bodies. So body shame or shame should not have any place in our community. So in this video, in the first 47 seconds, I talk about how common is vaginal thrush. And I will also talk about what thrush is, what vaginal yeast infection is, what are the symptoms, home testing kits you can use, why do you get vaginal yeast infections, and how to get rid of it. And we also have options, so pharmacy, medication, and I also talk about, does a sexual partner need treatment if you have vaginal yeast infection, and when to see a doctor, and how to prevent thrush. So thank you for watching, and let's get into it. So first of all, what is vaginal yeast infection? So, a vaginal yeast infection, also known as candidiasis, is a common condition. A healthy vagina contains bacteria and some yeast cells. So, but when the balance of bacteria and yeast changes, the yeast cells can multiply, and this leads to intense itchy feeling, swelling, and even irritation. So, treating a vaginal yeast infection can relieve symptoms within a few days. In more severe cases, it may take up to 2 weeks. So, vaginal yeast infections aren't considered a sexually transmitted infection, STI, commonly known as STD, sexually transmitted disease. So, sexual contact can spread it though, but women who aren't sexually active can also get them. So once you get a yeast infection, you are also more likely to get another one. So what are the symptoms? How will you know that you have an infection? So yeast infection symptoms are as follows. So vaginal yeast infection have a common set of symptoms such as vaginal itching, swelling around the vagina, burning during urination or during sex if you're sexually active, pain during sex, soreness, redness, and even rash. So you can also have a discharge, whitish, gray, and a clumpy vaginal discharge is another telltale symptom. So some people say this discharge looks like cottage cheese. Sometimes the discharge may also be watery. Usually, the length of time your yeast infection is left untreated has a direct impact on how severe your symptoms may become. So, what are the causes, you might wonder? So, the fungus candida is a naturally occurring microorganism in the vaginal area, and lactobacillus bacteria keeps its growth in check. So, but if there is an imbalance in your system, these bacteria won't work effectively. This leads to an uh, overgrowth of yeast, which causes the symptoms of vaginal yeast infection. So, several factors can cause a yeast infection, including the following. The first one is antibiotics. So, when which antibiotics decreases the amount of lactobacillus, the good bacteria in the vagina, and we also have pregnancy. We can also have what we call controlled diabetes. It can also cause yeast infection. Weak immune system can also cause yeast infection. Poor eating habits, including a lot of sugary food, so you should avoid that. Hormonal imbalance near your menstrual cycle can also cause yeast infection. Stress, and lastly, lack of sleep. So, and a specific kind of infection called Candida albicans causes most yeast infections. So these infections are easily treatable though. If you are having recurring yeast infections or problems getting rid of an infection, which with the conventional treatment, then a different version of candida might be the cause. So a lab test can identify what type of candida you have. How are vaginal yeast infection diagnosed? So yeast infection are simple to diagnose, and your doctor will ask about your medical history, and this includes whether you have had yeast infections before. They may also ask you if you've ever had an STI. So the next step is what we call a pelvic exam. So your doctor will examine your vaginal walls and cervix, and they'll also look at the surrounding area for external signs of infection. So depending on what your doctor sees, the next step may be to collect some cells from your vagina. So these cells will go to a lab for examination, and lab tests are usually ordered for women who have yeast infections on a regular basis or for infection that won't go away. So how are they treated? Treatment of yeast infection. So each yeast infection is different. So your doctor will suggest a treatment that is best for you. And treatment are generally determined based on the severity of your symptoms. So simple infections are treated differently. So for simple yeast infections, your doctor will usually prescribe a 1 to 3 day regimen of an antifungal cream, ointment, tablet, or what we call suppository. So these medications can be in either a prescription or an over-the-counter OTC form. So common medications include this one what we call butoconazole or gynazole, and we also have clotrimazole or miconazole or teconazole or fluconazole. So all those medications can be used to treat simple yeast infections. Women with simple yeast infections should follow up with their doctors to make sure that the medication has worked really. And you also need to follow up a visit if your symptoms return within 2 months. So if you recognize that you have a yeast infection, you can also treat yourself at home with over-the-counter products. What about complicated infections? Your doctor will more than likely treat your yeast infection as if it were a severe or a complicated case if one, if you have severe redness, swelling, and itching that leads to sores or tears in your vaginal tissue. Two, if you have had more than 4 yeast infections in a year, and 3, if you have an infection caused by Candida other than Candida albicans, and if you are pregnant, or if you have uncontrolled diabetes or a weak immune system from medication, or if you have HIV. So possible treatments for severe complicated yeast infections include a 14-day cream, ointment, tablet, or a suppository vaginal treatment, or 2 to 3 doses of fluconazole, that is Diflucan, and also a long-term prescription of fluconazole taken once a week for 6 weeks, or long-term use of a topical antifungal medication. So if your infection is recurring, you may also want to see your sexual partner if your sexual partner has a yeast infection. So remember to use barrier methods such as condoms when having sex if you suspect either of you has an infection, and talk to your doctor about all of your yeast infection treatment options. What are the home remedies for yeast infection? Because some condition you don't necessarily need to see a doctor or take any medicine, but you can opt for home remedies. So you can try to treat vaginal yeast infection with natural remedies. So if you would like to avoid taking prescription medication, but these aren't as effective or reliable as the indicated medication. Some popular natural remedies include coconut oil, tea tree oil cream, garlic, boric acid, vaginal suppositories, plain yogurt taken orally or inserted into your vagina, and always make sure your hands are clean before applying creams or oils to your vagina. So you may also want to talk to a doctor before trying natural remedies though. This is important because if your symptoms are due to something more than a simple yeast infection, your doctor can help diagnose your condition. So talk to your doctor about herbal remedies if you take over-the-counter prescription or prescription drugs. And remember, some herbs can interact with medication you may be taking or can cause other unintended side effects. What about yeast infection in men? While vaginal yeast infections are more common, it is possible for men to get yeast infections too. When it affects the penis, it is known as a penile yeast infection. All bodies have candida, not just the female body. So when there is an overgrowth of this fungus, it can lead to yeast infection. So the groin area is especially prone to candida overgrowth because of the skin folds and moisture. So still, penile yeast infections are most commonly caused by having unprotected vaginal intercourse with a woman who has the infection too. So you can help prevent a yeast infection by wearing condoms during sex, and regular bathing can also help. The symptoms of a yeast infection in men may not be as prominent though. You might see redness and white patches along the penis, as well as burning and itchy sensation. So see your doctor for a proper diagnosis if you think you have a penile yeast infection. Yeast infection in women. So yeast infections are extremely common in women. In fact, it is estimated that 3 out of 4 women will get more than 2 vaginal yeast infections in their lifetime. So despite their prevalence, it is important to treat vaginal yeast infections early. Not only will you alleviate uncomfortable symptoms, but you can also reduce the chances of the infection becoming more widespread in your body. So remember that recurring yeast infections are common, especially if you are pregnant, have diabetes, or have a weakened immune system. So talk to your doctor if you have more than 4 yeast infections per year. So how can you prevent vaginal yeast infection? So chances are that you know exactly what led to your infection. For example, some women experience these infections every time they take antibiotics. Whether you know the exact cause, here are some habits you can adopt to and avoid to help prevent recurring infection. So take up eating a well-balanced diet, eating yogurt or taking supplements with the lactobacillus, wearing natural fibers such as cotton, linen, or silk, washing underwear in hot water, replacing feminine products frequently, and avoid the following: wearing tight pants, pantyhose, tights, and leggings, using feminine deodorant or scented tampons or pads, sitting around our wet clothing, especially bathing suits, sitting in hot tubs or taking frequent hot baths, and also avoid douching. Yeast infection essential oil. So, essential oils have garnered a lot of attention in the last several years as natural remedies to common medical ailments. These plant based products can be powerful, but so far, no research has shown that essential oils work better for yeast infections than conventional methods. So, one issue with essential oils is that some people might be allergic to them. It's a good idea to do a patch test on a small area of the skin before applying them to larger areas of the body. So, this is especially important when considering sensitive areas such as your vagina. It's also important to dilute oils properly before you use them. So, confirm with your doctor that your symptoms are indeed caused by a yeast infection before trying out essential oils as a treatment regimen. So, you can also ask them about safer oils such as coconut oil for your yeast infection or the rest. What about yeast infections and periods? Having both yeast infection and your period can feel like a double whammy. However, it is this isn't uncommon. So yeast infections are most likely to occur in women during the final days leading up to their period, and fluctuations in hormones are thought to be the major cause of yeast infections before your period, causing imbalances in healthy bacteria and in the vagina. So, if you experience white to yellow discharge in the week before your period, this isn't automatically an yeast infection. Um, uh, what's key is if you experience other hallmark symptoms too, such as redness, burning, and itchiness. So, while inducing early treatment can help clear up your yeast infection before your period starts, see your doctor if your yeast infection symptoms do not improve after your period ends. You may also want to see your doctor if you continue to get yeast infections before your period every month. So the bottom line and takeaway from all these episodes is that yeast infections are common occurrences, but prompt treatment can help reduce the uncomfortable symptoms within a few days. And by recognizing your own risk factors, you can prevent future infections. So, talk to your doctor if you have a recurring infection that lasts longer than 2 months. Thank you so much. Thank you so much for joining me for today's episode. I hope this was helpful. I have a disclaimer though that information contained in Alex and Dawson's channel should not be a substitute for a professional or medical care. So it is just for information purpose only. So make sure you see a doctor and consult appropriately if you have any health condition, and you should not substitute anything you read on the internet or you watch on this channel or general on YouTube with professional medical care. So thank you so much. Bye bye. I wish you good health, and remember, a like is always appreciated. Turn on that post notification bell so that you won't miss any of our upcoming episodes, and do well too to subscribe to our channel so that you will be connected. Thank you and bye bye. I wish you good health.